With a dramatic increase in the tick population over recent months, I've become a lot more concerned about our four-legged family members. What sort of risk does Lyme disease present, and what do I do if I find a tick on one of our dogs? So I reached out to Dr. Alex Avery, a veterinarian from the Our Pets Health YouTube channel, and I'll post a link to his channel in the description below so you can check him out. But he's going to shed some light on what Lyme disease is and what sort of risk it poses for our pets. I'm Ken Steep, and welcome back to McCann Dogs.
I'm Dr. Alex from OurPetsHealth.com and the YouTube channel Our Pets Health, where my aim is to help you and your pet to live a healthier, happier life. So Ken and the team at McCann Dogs, they asked me over to talk to you today all about the problem of ticks and the tick-borne disease known as Lyme's disease in dogs. So today I'm going to talk to you about what Lyme's disease is and answer what are the symptoms of Lyme's disease in dogs you need to be aware of. So Lyme's disease is caused by the bacteria Borrelia burgdorferi and is transmitted by tick bites. It is not just a dog problem and can cause infection in a large range of animals, including humans, and that's really important to remember. Rodents, though, are generally the most common reservoir of infection. And once an animal becomes infected, what the bacteria does is it multiplies in that region to start with, and then it spreads to other parts of the body. So in dogs, joints are actually the most common place that the bacteria travels to, where it can result in a really nasty infectious arthritis, and that can lead to permanent debilitating damage if the infection isn't cured quickly. It can, though, also cause problems and damage to the lymph nodes, to muscles, to eyes, to kidneys, to the brain, and also to the heart, and that can result in conditions like meningitis and kidney failure. Thankfully, though, these other complications of infection with Lyme's disease are pretty rare. Okay, so that's the disease in brief, but what are the symptoms of Lyme's disease in dogs that you should be looking out for? Well, the first point to make is that the disease, it can be really slow to develop, taking weeks or even months sometimes to appear after an infected tick bite. Once signs of infection are showing, you might notice a range of different symptoms. And these can include lameness with painful and swollen joints. Stiffness and muscle pain might also be present. Your dog will also likely develop a high temperature and go off their food, just being generally unwell. If more than the joints are infected or affected, then you might notice nervous problems due to meningitis, such as neck pain, general stiffness, and even seizures. If the kidneys are damaged, then you might see vomiting, you might see your dog having diarrhea, they might go off their food still. You might also notice an increase in drinking and urination, as well as your pet losing weight and just generally being unwell. So vision problems can also develop, and if the heart is affected, then you might notice weakness and collapse and things like that, though again, those problems are pretty uncommon. Now clearly, if any of these signs of Lyme's disease are present in your dog, then you should definitely be consulting your veterinarian straight away. They will assess your pet and they'll do any testing that they feel appropriate. So as you can imagine from all of the signs of Lyme's disease I've just gone through, they're really non-specific, so they could be caused by quite a large number of different conditions, and that will likely mean that your vet will want to do a number of different tests and a whole range of different investigations. So that might mean x-rays, it might mean joint taps and taking a sample of their joint fluid, as well as blood and urine testing in the first instance. When it comes to specifically diagnosing Lyme's disease in dogs, this can actually be really tricky. Now, most commonly your vet will run what's called an antibody test, and this measures a specific part of the body's immune system that responds to infection. The problem is, though, is that it can take several months for the antibodies to become high, and also once they are high, then that can persist for a couple of years. So what this means is that your vet may want to repeat the test. So if the antibodies levels are low, they might want to repeat that test a few weeks later to see if they're climbing, which might indicate that your dog has an infection. And if a single test shows a high antibody level, then this might mean that a dog is either currently infected, or it might mean that they were infected at some point in the past. Based on all this information, when infection is felt likely, or even just a possibility, treatment can then be started. Now, thankfully, the treatment of Lyme's disease in dogs is relatively straightforward. Antibiotics can be given. Most dogs will respond within 1 to 2 days, and if there's no response in a week, then the diagnosis may need to be reassessed. At the same time, painkillers should obviously be given. Your pet is likely to be really uncomfortable. And it's also important that treatment's continued for long enough to ensure that the infection is properly cleared from the body and a persistent low-grade infection doesn't maintain. This can actually take some time, so your pet may be on medication for quite a long period of time. If the infection has caused problems elsewhere, such as in the kidneys, then other specific treatments might be needed. Each case needs to be assessed and monitored individually. It's important to mention just how much of a threat Lyme's disease is. In areas where the disease is really widespread and it's found everywhere in the environment, then about 75% of dogs, or that's 3 in every 4 dogs, will become infected. That sounds a lot, but thankfully, of these, only about 5 to 10% will ever show signs of Lyme's disease. This though is clearly a significant number of dogs, but for the rest of those, the body's immune system does its job and it protects the body from infection. I hope all this information has given you some answers to any questions you might have had about ticks and Lyme's disease in dogs. I'd really encourage you to talk to your vet and your veterinary team just about the risks in your specific area and come up with a real preventative treatment strategy that is best for your dog, using whatever preventative is best suited to your lifestyle. Remember too that Lyme's disease can infect people, so tick prevention in us by using things like wearing long trousers, using repellents like DEET, and checking yourself for ticks is also very important. So I'd like to give a big thanks to Ken and the team at McCann Dogs for inviting me back to talk to you today. You can find my other video on this channel all about vaccinations in your dog. And of course, I've got plenty of other videos over on my channel at OurPetsHealth, where my aim is to help you and your pet to live a healthier, happier life. So until next time, take care.
A big thank you to Dr. Alex Avery from the OurPetsHealth YouTube channel. And if you want to check out more of his channel, just click that button beside me. Now on the other side is a video that talks about a systematic approach to checking your dog for ticks. On that note, I'm Ken. Happy training.